Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. As you know, it's just after 8:30. We're live from the studios of British Muslim TV here in Wakefield with this week's edition of Questions. I'm your host, Mohammed Shafiq. Thank you so much for joining us. We hope you've had a good week. Whilst my autocue is stuck, I'll talk to you at home. I want to say thank you so much. Today, Boris Johnson has set out the government's plans to lift COVID restrictions, return to Plan A from Plan B, which means a lifting of the request to work from home if you could, the mask wearing and changes in terms of social distancing and where you wear a mask. We'll get through some of that as we get through the programme. But the most important thing is that we are here. We are here live on our studios. The joy of technology. We're broadcasting Sky Channel 752 and across social media, British Muslim TV. Wherever you are joining us, a very warm welcome. Now, we want you to comment on the big story we're covering tonight around COVID, the vaccine and the pandemic. You can call us on 01924 231 083 or messages on the WhatsApp number, which is on the screen now. And if you're watching this on Facebook Live, hello, nice to see you. Post your comments in the chat box and we'll read some of them on air later. Now, we dedicate tonight's programme to the COVID pandemic, NHS pressures and the vaccine. Firstly, we head to Manchester to talk to the NHS England's Deputy Director for Vaccine Equalities, Abdul Hamied, about booster vaccines amongst minority communities. We then go to East London and talk to Dr. Jahangir Alom. He's an A&E doctor and a clinical lead for staff vaccination programme about how he's coping during the pandemic and what impact has COVID had on British Muslims. We then finish off in Cardiff in Wales with an exclusive interview with Dr. Bnar Talabani, MBE, about the vaccine and the science behind it. She'll be taking some of your questions during that segment. So we want to hear from you tonight. You can call us on 01924 231 083 or messages on British Muslim TV across social media. Alternatively, you can send us a WhatsApp message. The number is on the screen. I should always look to my left because it's on my right, but it's on your left. But anyway, it's on the screen there. The number, as I said, is coming up on the screen there. Now, the questions we're considering tonight. What have you made of the government's announcement today from Boris Johnson that those remaining COVID restrictions, Plan B restrictions, will be lifted from next week and will return to Plan A? How do you feel about that? And have you had your booster? If not, why not? Talk to the scientists and the experts here tonight on health. And what is the pressure on the NHS? Are you all worried about treatment and operations being delayed because of the pandemic? And why is the science not being recognised when it comes to the vaccine? Is the vaccine safe? Please share your thoughts on 01924 231 083. Messages on WhatsApp. We'll get through some of them throughout the programme. Now let's get started on the first part of tonight's special programme on the pandemic and the vaccine rollout. In December, as the Omicron variant spread across the country, there was a key decision for the Prime Minister Boris Johnson and his cabinet. Do they wait for the evidence to be clear on the impact of the variant, or do they take immediate action to slow the spread? Now, there was a mixed response here in the UK. Scotland and Wales decided to introduce tougher and stricter restrictions. And in England, Plan B included working from home if you could, wearing a mask in public places, and the rollout of a third dose of the vaccine. But the government refused to introduce further restrictions in England in the immediate aftermath of Christmas. Now, as cases have come down, was that the right decision made by Prime Minister Boris Johnson and his government? The truth is, our community bear the brunt of this pandemic. Thousands have died and many families are still suffering. And getting the vaccine has been so important to protect ourselves and those around us. The government recognised that take-up of the vaccine amongst minority communities is really low and something needs to be done. Abdul Hamied is the Deputy Director for Vaccine Equalities for NHS England. He's leading the campaign to get more BME communities to get that booster. Pleased to say that Abdul Hamied is live on British Muslim TV from the great city of Manchester. Abdul Hamied, a very warm welcome to the programme. Thank you so much for joining us tonight.
Assalamu alaikum, Mohammed Shafiq, and thank you for the opportunity and the invitation. I'm really looking forward to having a conversation and hopefully sharing some information that might help some of our Muslim communities.
Now, the NHS is vast. Lots of people working on the front line in those emergency situations. You are also a key worker working in the NHS. How's the pandemic been for you and the family?
It's been a really interesting experience. I've been involved in supporting the vaccination program in 2 different roles. When the pandemic was initially unleashed upon us, I was working within the NHS England's People Directorate, and as part of that work, we established a response for the healthcare workers. And in particular, my role was to support the COVID-19 psychological health and well-being program to help our staff cope with all the extra pressures that were being placed upon them to care for our populations, to kind of work the extra hours, go through the extra miles. So it was all about well-being, taking care of them, to protect their integrity, but also protect their well-being so they could continue to provide services. However, I did take a little break in March, and I went to Azad Kashmir in Pakistan.
You did, yeah.
I think it was around the 12th of March I went for 2 weeks with a view that I'll come back and hit the ground running. And as soon as I got there, the Pakistan government announced the lockdowns, which meant that my 2-week break was extended to 6 weeks due to enforced cancellations of various flights.
Yeah.
And that provided me an opportunity to spend the longest time in Azad Kashmir, Pakistan, since I had done since I was about 9. So I was able to reminisce some of the journeys I had as a child. We also spent some quality time with my family by not doing anything other than spend quality time.
Yeah. That's kind
of.
Yeah, we're just
Sorry.
So we're just going to say that I think that has been one of the benefits, if there has been one, of the pandemic. It's allowed families to be closer together. I've worked from home. It's actually really easy to spend more quality time, and I feel as if my relationship with my children and my wife is better. I like to think that. I don't know what my wife thinks, but the fact that we spend time together at home.
I think for those people that have lived a busy life, the restrictions enabled us all to spend, and I've been working now for the last 2 years from home, which has meant that my travel journey has been reduced. My daily trips or weekly trips to London have been reduced, which means I'm not only saving financially and contributing to the environment, but also being able to spend more time at home. However, for those of us working very closely to the pandemic, the day doesn't start early and doesn't finish late enough, because we've been working flat out to make sure that we're able to do as much as we can to protect the populations. So whilst working from home has been a benefit, it has been a little bit of a challenge. And I think for some people, it's also had an economic impact, especially if they've not been able to work. Some of those breadwinners who are daily workers who've not been able to get the benefit of the furlough scheme, it's been a bit of a challenge. And also for some of those smaller households where people are living in small houses, when everybody's at home, it does get to a point where you can't work on team like we are doing, because there's a lot of interruption happening.
Obviously.
And for our elderly, for those people that rely on social interaction by going to the masjid to prayers, or to on Friday prayers, meeting some of their friends, that's meant that those people that are living on their own have become more and more isolated, and their health and well-being probably get worse.
Yeah, well, we'll explore that in a second. We're probably about 5 minutes away from our first break, but let me ask you this. You're working in the NHS. There's been an adverse impact on the British Muslim community, but ethnic minority communities. What does the evidence suggest about the impact this pandemic has had on our communities?
So the data that we're seeing is both from healthcare workers and also our populations. Those underserved communities, those ethnic minority communities, have been adversely impacted, i.e. they've had a greater negative impact. And what that's highlighted is the work on disparities, which is very clear that these communities have, over the long term, been having poorer health outcomes, poorer health inequalities, and that is down to a range of situations. That could be down to our own lifestyles, our own diet, but also the fact that we are not getting the appropriate health services that meet the needs of our community. So it is become very, very clear when you look at the clinical colleagues that have sadly lost their lives by working on the front line. Most of them have been from ethnic minority communities. If you look at the people that are being admitted to hospital, what we are seeing is if any ethnic minority, people from Pakistan, Bangladesh, India, Black African Caribbean communities, when they attend hospital, the impact on them is far worse. And what we're also seeing now is that the wider health impact is going to now become more of a challenge. And we really need to make sure that as we come out of COVID, the lessons that we can learn from all the work that's happened in engaging communities, in providing services to communities, translate into what is known as normal healthcare services. And I'm fortunate enough to be just moving across from the vaccine program to the National Health Inequalities Improvement Team, where I'm hoping that we can continue some of this work to help around diabetes and cancer prevention or early diagnosis, CVD, etc. So hopefully we've got a big challenge now, and we need to find a way of addressing that. But it's very clear, data is showing that the ethnic communities have had a greater impact, and that opens up the door for disparities.
Okay, one more question before the break. Vaccine rollout has been an important weapon to manage this pandemic and get the light at the end of the tunnel. How safe is it? How safe is this vaccine for people from our community?
So, I mean, there's a lot of concern and a lot of myth, and I'm hoping my colleague Jahangir, who's a GP, will be able to elaborate on this. There is a lot of perception out there that this vaccine has been developed too fast, and that we are trialing and testing that on our populations, and therefore the side effects for that are not known. What people need to understand is that this vaccine is built upon previous vaccines. So we have an annual flu vaccine, which we've been having for many years. There's been a range of other vaccines that have been available across the world, addressing a range of different immunization situations. And some of us have had the TB situation, and historically, the ethnic minority communities have actually had to go through quite a lot around vaccination to improve our life chances and life expectancy. So this vaccine, although it seems it's been done quickly, it's had a lot of history, it's been adapted to, on what was working, but then the whole financial muscle that came behind the COVID program has meant that companies have been able to invest significantly. Instead of having one person working on the vaccine, they've had thousands of people working and doing the testing and trialing. Instead of having small cohorts of populations to do the trial, we've had thousands of people coming forward to be part of the trial process. And then lastly, normally the bureaucracy takes forever. Every step takes 6 months. And that's what prolongs a new medicine from coming onto the market or into the NHS. However, due to the importance of COVID, all the bureaucracy was compressed. And those people that know something called just in time, almost all the steps were being lined up. Finance, testing, trialing.
And do very quickly. Just bear with us there. Sorry, Abdul Hamied. We're 20 seconds away from our break. What we'll do, we'll take a break. I know you're staying with us there, Abdul Hamied, and we'll come back and continue the conversation, but also take your calls. Join us on the other side of these very important messages. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Questions with me, Mohammed Shafiq. My special guest is Abdul Hamied, who works for the NHS England. We're having an exclusive conversation about the vaccine and the impact it has on our community. Now, before the break, Abdul Hamied, we were talking about the low take-up of the vaccine, whether the vaccine is safe, what's the testing involved, why is it being fast-tracked, how can you reassure people?
So I think, as I was just saying before the break, the level of investment, because of the importance of finding a cure or finding a vaccine for this particular pandemic, has meant that significant investment has been made by government as well as some of the companies, the staff that have been able to work on it. Normally you have 1 or 2 working on a 3 or 4 year program. This has been brought together in a fast pace with a ridiculous amount of staff and volunteers, as well as people volunteering to be part of the trials. And then the governments and all the bureaucracy systems have been speeded up to consider and make decisions, not make a decision irrationally, but make decisions faster because all the evidence is there. We hear a lot of conspiracy theories around it's got the Bill Gates chip in it, it's got some porcelain content, etc. It's halal, it's vegan, it's been proven to be effective. Now, it has had some effect. Now, you'll have seen the work around the AstraZeneca. There was some adverse side effects, as a result of which the further rollout of that was slowed down. It didn't go down to younger cohorts, and Pfizer was the main preferred vaccine. And then we do have side effects. We get a little bit of temperature, and some people will have a bit more than others. I mean, for example, amongst myself and my brother, we had the vaccine AstraZeneca on the same day, and he went home, had a temperature, had a bit of a fever for a couple of days. I was thankfully back to normal straight away and back to work. So it has a different impact on different people, but people have made that misinformation has really cast a doubt in people's mind about the vaccine. It is proven to be safe. In England, we've given over 110 million vaccinations, and we've not had significant adverse reactions as people fear within our community.
Now, why do you think it's so low? So lots of activity last year to get, I think in January when I had those conversations with the NHS, it was around low figures. There was lots of activity in the community, prominent people like myself. We did videos and, there was activity around that and there was a massive uptake. Now in the booster, the figures are low. What can you just tell our viewers what are the figures in terms of booster take-up in the Muslim community?
Yeah, no, thank you. So obviously, as you know, we don't have data on the Muslim community. So what we do is we look at Pakistani, Bangladeshi, the characteristics. But in terms of the first dose, as you said, thank you for your help and for your viewers. We were able to increase the vaccine uptake in the first dose. So for example, for cohorts 1 to 9, which was for 50 plus, including healthcare workers and social care workers, the gap within the dose 1 uptake within the Pakistani community currently is at 11%. In comparison to the white British community or white Irish community. For the Bangladeshi community, that's 5%. For the Indian community is 4%. That's nationally. When you go down to cohorts 10 to 12, which is 18 to 49-year-olds, for the first dose, the gap between the white British, white Irish, and the Pakistani community is 15%. And for the Indian and the Bangladeshi community is around 8%. So we have made significant progress in the first dose. And what we are seeing is 96% or more of those people that have the first dose come back to have their second dose. So I think all that work we've done has been really good. And we've still got a challenge. Around England, we've got over 5 million people that have still not had their first dose of the vaccine, and we continue to work to support that. In relation to the booster, and you're right, the booster uptake seems to be much lower. So as at the 7th of January, the booster uptake is 82% for the British Irish community, the white British and white Irish community. And that's for those people that are eligible, because some people will have had their dose 2 more recently, and therefore they are not eligible for their booster. However, that 82%, which is the white British uptake, this drops to 70% as a booster uptake for the Indian community. It drops down to 56% when it comes to the Bangladeshi community. However, across all the ethnic groups, the Pakistani community has the lowest uptake currently in relation to the booster, which stands at 50% of the white British, white Irish level. So you can imagine a big drop based on the figures for the dose 1. So we recognize that we've got some challenges. There are people who feel, well, they said 1 dose, then they said 2, now they're saying booster. There's an element of vaccine fatigue emerging. There's also a sense of younger children influencing some of their parents to maybe not come forward and have the vaccine. We are continuing to make sure the vaccine is available through all the local channels, the pharmacies, local PCNs, the GP surgeries. We are continuing to work with community centres. We continue to work with mosques, as well as some businesses who are making their services and their facilities available to enable us to make the vaccine much more accessible. Now, perhaps the winter period has meant that some people were reluctant to come out in the cold, and we are trying to address that. And what we've done, for example, since yesterday, the Tuesday, is we've launched a whole week of walk-in vaccination or grab a jab for any group, first 12 plus, first dose, all the way down to booster. And these are about 2,000 vaccination sites across the country that are participating. So we are doing everything we can to try and improve the access and also send a lot of information around communications. What we do need is people to trust the clinicians rather than Facebook or the social media.
I really wanted to give you as much time to explain that, and that's why I didn't interrupt you. But I really want to touch on that point about fake news and propaganda, which is perpetuated. I've lost count the amount of conversations I'm having within our communities, about the booster and about the safety of the vaccine, by people who everybody seems to be an expert on vaccine now. Even you look at taxi drivers, and I don't know. Anyway, I'm just going to ask you the same question. How do we tackle that fake news and propaganda?
I think the best thing we can do is trust in Allah subhanahu wa ta'ala as the most important thing. But we need to trust in the people that we normally trust. So we put our lives in the hands of our NHS colleagues when we have an emergency operation or an accident and we end up on A&E, or on our daily routine visits to our general practice, where we trust them to look after our welfare and well-being and prescribe us medication which will help us get better with minimum side effects.
Because Abdul, that's the point, isn't it? I was saying to somebody the other day, you go to your doctor, you've got some symptoms, you tell your GP, the GP prescribes a prescription. You don't really ask him what's in the prescription. You go to the chemist, you get the medicine, you take the medicine.
Yes,
yeah, when it comes to the vaccine, we're suddenly thinking, oh no, we don't trust the doctors, we don't trust the medical experts.
I think, you are 100% spot on, is that at the moment people are all becoming experts. And I think what we need to recognize is that each one of us may look at some data with a particular lens. But what happens, our clinical colleagues and now scientific colleagues, especially the JCVI that issue the guidance, they take into account a whole range of factors, a whole range of data to come together to form a view which is in the best interest of the population. And if people feel that they want to spend more time trying to understand, we don't do that for the rest of our stuff. We don't look at that when we go shopping to any of the cash and carries or Asian shops or even some of the English shops. Half the time we don't know what's in the cheeseburger, and most people are having a cheeseburger quite frequently. And like you said, when we go to the doctors, we don't know what's in. I mean, I don't know what's in paracetamol. We have been having it for years. And equally, if I was to end up in hospital for an emergency situation, I won't even have a clue what medication I was being given. All I'll be doing is expecting the doctors, the clinicians and the consultants to have my best interests at heart and to give me the medication that will ease my pain, relieve me as quickly as possible, and more importantly, ensure that I do not, go to my Lord. So I think that's the thing that we expect. And I think we all want to be experts in this particular field right now. And I think people need to trust their faith leaders, their community leaders. They need to trust their clinicians, who are the ones that have been looking after us since we were born, for those of us that were born in the UK. And for the rest of us, when we've arrived, one of the things that the world kind of acknowledges actually is the English system for the NHS, or the British NHS system.
Now, we know that when we had the vaccine rollout this time last year, lots of money was put into BME Media, and, people like myself were encouraged to partake in a campaign, as other prominent British Asians were. Is the same sort of resource now being put in to the booster campaign to tackle that 50% and, the 56% amongst Pakistanis and Bengalis?
So I think in terms of investment, I mean, the NHS continues to provide resources through the NHS structure, so the integrated care systems, local CCGs, to try and address some of the challenges that we've got by working with our community groups, our faith leaders, our community engagement expertise that we have, something like 22 million to 60 local authority areas that have been identified to have the largest challenge in relation to vaccination. This builds on 22 million that was invested last year. That's just the tip of the iceberg. There's been a significant more funding made available. So local community groups and organizations, I would really encourage them to engage with their directors of public health, the local CCG and local authority to access some of that funding where they can add value and help us increase vaccine uptake. And in relation to comms, I mean, one of the conversations I'm having right now is what more can we do through our ethnic media, through our ethnic press, including some of those local channels, because we are working with national channels and national media outlets. But as you know, within the Muslim and Asian communities, we have small community radio stations which link to Radio Ramzan, for example. We have quite a few local newsletters. So we are looking to see what more can we do through the ethnic media. But more fundamentally, actually, is how can we engage some of those social influencers? And as you know, you're one of those, Mohammed. So what we need to do is what other channels have we got? How can some of our community champions, some of our social influencers, some of our MPs and lords and MBE holders, what can they do to reach to their communities by providing a message that makes sense rather than some of the garbage that we end up seeing on Facebook and other social media platforms?
Yeah, we've got about 60 seconds left, Abdul Hamied, with you. What's your message to British Muslim TV viewers watching this around the UK and the world about the booster vaccine and how important it is to take it?
First thing is, we know the vaccine is the key kind of source for helping us overcome this pandemic. Otherwise, the world will be in a much more crazy place, because we saw what happened when the pandemic was initially identified. And second thing is, obviously trust in Allah, but trust in your professionals, the medical colleagues who spend all their life in this particular environment. And thirdly, if you can, please spread a positive message. What we find is that too much of negativity spreads like hot fire within our communities, but we need to spread the positive message, which is, how can it improve our quality of life? How can it protect me and my family and my loved ones?
Well, Abdul Hamied, I know you're moving to a new job role. Best wishes. Look forward to welcoming you back and looking at tackling that inequality within the NHS. But thank you so much once again. Best wishes to you and your family.
Thank you for your time and your opportunity. Thank you.
Well, thank you so much. It's always a privilege to see you virtually. So anyway, what we are going to do, we're going to take a break. When we come back, we're going to head to East London and have a conversation with the A&E doctor, Dr. Jahangir Alom, about serving on the front line during this pandemic and what does that impact of COVID have on minority communities. Join us on the other side of these very important messages. Assalamu alaikum. Welcome back to Questions with me, Mohammed Shafiq. Now, as I was saying throughout the programme, Boris Johnson has announced in House of Commons today that in England, the Plan B measures that were brought in just before Christmas are going to end. Some of the things that will end, face masks will no longer be compulsory in public indoor places and on public transport from the 27th of January. And for secondary pupils who have to wear face masks in classroom, that will end from Thursday, the 20th of January, which is tomorrow. And for communal areas, that will be announced in the next few days. The guidance to work from home will also end from today. And COVID passes, proof of full vaccination, which people have had to show a recent negative test. This is like in nightclubs, big sport occasion venues as such, and other large venues. That will certainly end as well. And the legal requirement to self-isolate if you are positive of COVID will remain, but there's a view that those legal requirements finish in March. So the legal requirements finish in March. The government is minded to let them lapse. That means they will end in March. So the idea that if you do get COVID, you have to stay at home. Common sense will tell you to stay at home, but the government will not force people to stay at home by using the fine system and criminal justice system. So that's what he's announced today. We'll keep an eye on that in the weeks to come and the impact it does have. Obviously, cases are still high, but on the way down. Let's move on to our next guest. East London has a large Muslim community, and that community, like so many parts of the country, have been impacted by this pandemic, resulting in death, loss, trauma, and emptiness. Now, with so many British Muslims working on the front line in the NHS, what impact has this pandemic had on their lives and their families? My next guest is Dr. Jahangir Alom. He's an A&E doctor at the Barts Trust Hospital in East London. He's the clinical lead for staff vaccination and has a distinguished record of service for British Muslims in his area. Pleased to say Dr. Jahangir Alom is joining us live on British Muslim TV from East London. Dr. Alom, assalamu alaikum. Welcome to the programme. Great to have this conversation.
Wa alaikum assalam, Shaf. Thank you so much for having me.
It's a pleasure. First, from me and all the team here, thank you so much for all that you do in the NHS during this pandemic. How are you and your family coping, or have coped during this pandemic?
Well, first of all, before I start, I wanted to say thank you very much to your viewers. The support the Muslim community has shown the NHS and the generosity the Muslim community has shown the NHS hasn't gone unnoticed. To answer your question, it's been a very difficult time. I come from a large family. I have 9 siblings. I have 2 elderly parents. And so as soon as the pandemic started, my main priority was to make sure my parents were safe. So as soon as it all kicked off, I moved out of my family home to make sure that I didn't put my parents at risk when I was working in such a high-risk environment where we looked after COVID patients every single day.
Now, you never stopped working during, the beginning of, since the pandemic started. Why was that so important for you?
So let me give you a little bit of background, Shaf. I went to medical school on the back of one statistic, which said that people from East London died 7 years earlier than people from West London. And that inequality was what drove me to study medicine, to train as a doctor. So as soon as the pandemic started, my my passion, my heart, my drive was to serve my own community. And so I came back to East London. I worked in the trust that I was born in to make sure that I was able to look after my own people. And that's what motivated me, the desire to help my own.
And we know that there is a huge Muslim community in East London, very diverse. What impact do you think this pandemic has had on that community?
So in East London, we've got a very diverse community. In the borough of Tower Hamlets, the ethnic group that has the largest number of, or the largest population, is the Bangladeshi community. And as you know, the Bangladeshi community predominantly are Muslim. The third largest community in that borough are the Somali community. And again, as you know, majority of that community are Muslim. So, you know, it has had a huge impact on our community. There is a level of deprivation in East London, which has become more and more apparent through the pandemic. We saw that mosques were closed during the first wave of the pandemic, and that really affected some of our elderly Muslims in the community, who often use that as a form of exercise, as a form of socializing as well, and you know, to support their mental health. So to see those restrictions in mosques were detrimental to the community. We saw higher numbers of people from East London, from ethnic minority communities, some from the Muslim communities, being more infected by COVID, being hospitalized by COVID, and sadly dying from COVID at a disproportionate rate.
I mean, how do you cope with so much death and illness? I mean, I lost my grandma, my uncle, and that was traumatic over the last, last year due to the pandemic. But having to work in the NHS, you don't get time to look at your own mental health, the colleagues, the impact it has. How do you deal with that?
I think, it's remembering that every death is a tragedy. And, you see people pass away, you see some really unfortunate circumstances, and it's important to pause, to reflect on those events, on those interactions that you have with people. For me, being a doctor is making sure that I'm compassionate. And, when that compassion is lost, I know that I'm burnt out. I know that this is not the job for me. But for now, that compassion is high, that passion to serve patients is still there, and reflecting on every interaction that you have and how you come across and that individual circumstance. You treat every patient as an individual.
Now, we were talking to Abdul Hamied just before the break, and he told us the figure of the booster campaign. 82% of white British people have had the booster, whilst only 56% of Bangladeshis have had that. Why do you think that is? Why is the take-up so low?
There's a variety of reasons. And I've been working in the vaccine space from the very beginning, having individual conversations with people. And there's various reasons people give. Sometimes it's about understanding how the vaccines were developed, some of the effects on your health, and sometimes it's mistrust in the system. So the things I like to highlight to people are, number one, the vaccine is safe in every community. 130 million doses have been given in the UK. We've seen research studies that show that it has no impact on fertility. We express the importance of pregnant women getting their vaccines, and how there's no interaction in breastfeeding. So those are common misconceptions people have, common worries people have, and it's important that as a doctor, especially from the Muslim community, especially from the South Asian community where numbers are slightly lower, that I reassure my own communities that the vaccination program is safe, and it is important to make sure you take every opportunity to look after yourself and to look after those around you.
Now, there is a sense that a lot of propaganda, fake news is being spread out across the country, and particularly within our communities, and that's why it's so low. How can we counter that?
Politely and patiently are the ways we can tackle that. There is so much information out there. The internet is so easy to access. We have so many messages come through on WhatsApp and various different social medias. And every day when I see patients who aren't vaccinated, they ask me, I've seen this article saying it alters my DNA. I sit them down and I explain the science. My colleague, Dr. Bnar, is going to come on shortly onto this program, and she'll explain the science in a very easy, very thorough detail. And she's brilliant at what she does. And as doctors, it's our duty to make sure that patients are informed with evidence-based medicine. And so, like I said, patience and politeness.
Do we have time to do that? Do we have time to counter that? Because time's not on our side, is it?
Time's not on our side, but every individual has the choice. And to be honest with you, Shaf, it is devastating, and it's so sad when I'm in A&E and I see patients who are so sick with COVID-19 who say to me again and again, "Doctor, I just didn't have enough time, or I was getting round to getting vaccinated. Is it too late to get vaccinated?" And at that time, yes, I'm afraid it is too late to get vaccinated. But should you get better from your illness, should you recover from COVID-19, then you can get vaccinated in 4 weeks from the date that you test positive or the day that you start having symptoms. But it is a tragedy, Shaf, every single time I look after an unvaccinated patient, because that could have been avoided if that individual had taken the opportunity to have their vaccine.
And I know you're not into party politics as such, but what's your reaction to the announcement today from the Prime Minister and the government that Plan B restrictions have been lifted over the next 7 days in England?
It's important for us to be cautious. As doctors, we follow evidence-based medicine, and again, we follow data. So I myself, even after the restrictions are lifted, will be wearing a mask. I'll continue to maintain social distancing where I can, and test as often as I can to make sure, number one, I'm safe. Number two, my patients are safe. And when I get the opportunity to see my parents, make sure that they're safe.
Yeah, that's really important. How is the atmosphere in the NHS? You've had really 2 solid years in this pandemic. How's morale in the NHS?
To be honest with you, Shaf, it's been exhausting. We were exhausted before the pandemic started, and the last 2 years we've been in full throttle, working our socks off. It's been difficult, but the camaraderie amongst colleagues has been great. But people are exhausted, and people are giving it all they can. But I don't know how much longer myself and my colleagues can keep going like this.
Yeah. Okay. I know you're going to stay with us. Dr. Alom, Jahangir Alom is there joining us from East London, and he will be with us shortly after the break. But just give you an update. The Prime Minister saying that the data is now suggesting the cases are coming down, infection rates are coming down across every region in England. And he says hospital admissions have stabilised, and therefore scientists now believe that it's likely that the Omicron variant has now peaked nationally. That's what the Prime Minister says. But he said he expects cases to continue to rise in primary schools, and pointed to significant pressure on the NHS in the northeast and northwest of England. But he said the government will set out its long-term strategy in learning to live with this pandemic. And obviously, as I said, in March, that legal requirement to stay at home if you are positive is something that we'll do. We've got a few callers waiting as well, quite a lot of callers waiting. We'll stay on the line, please. We'll connect you live on air very shortly. We'll take a very quick break, some very important messages, and we'll come back and talk to Dr. Jahangir Alom. Join us shortly. Assalamu alaikum. Assalamu alaikum. Welcome back to Questions with me, Mohammed Shafiq, exclusively here on British Muslim TV. Now, we're going to take some of your calls now on 01924231083. My special guest, Dr. Jahangir Alom, who's an A&E doctor based in East London, is my special guest and is joining us there from London. So let's open the line. Let's take a couple of calls. Let's go to the sister, I think, who's on line 1. Assalamu alaikum. Sister.
Hello, assalamu alaikum.
My Islam. How you doing? You okay?
I'm fine, thank you. Thank you for letting me on.
What would you like to say?
I have a question for Dr. Alom, please. Just regarding the vaccines, I have three thoughts that I wish that you would answer. The first one being, shouldn't we as Muslims encourage research into exactly what goes into the vaccine? And as far as I know, not even the FDA has the full documents yet as to what exactly is in it. Number two, don't you feel responsible as a Muslim that the Nuremberg Code is being broken every time we're administering the vaccine? So this is the first large-scale vaccine that's delivered or anything in the world where people are not actually signing anything in writing, and it's actually just verbal agreement. Not even that. People are just going into clinics and being made to do things that are not signed.
But they are giving their consent when they just before they have the vaccine.
Okay, so is that in writing?
Sorry?
Is that in writing?
Verbal. You would think verbal consent would be okay.
Yeah, no,
and then the NHS doctor, whoever would tick the box. I'm
thinking as a Muslim, we value a contract very much, and then if you go into the Nuremberg contract, consent is all about signing something before you go into.
Are you somebody who's? Are you somebody? Can I ask you a question?
I am a biomedical scientist and a PhD doctor.
That's fine. Have you? Can I just ask you a question? Let's have a dialogue. Can I just ask you? You've chosen not to take the vaccine, and what's the reasoning behind that?
But I'm being forced, and I'm being pushed in a corner to actually take it, which I think is horrible, because, as we say, there is no compulsion in religion.
But the vaccine's got nothing to do with religion.
Well, what I'm saying is, as a Muslim, we shouldn't force each other to do something or make each other, push each other into a corner to take something invasive. We should actually encourage a dialogue around that.
Thank you so much. Just stay there. Please stay there, sister. Dr. Jahangir, you've got a caller there who wants to talk about the research not being published, the contract, the verbal rather than written. What would you say to the sister?
First of all, walaikum salam, and thank you so much for calling and asking your questions. As I explained earlier, we, as doctors in the UK, in the NHS, we follow evidence-based medicine. Over 130 million doses of the vaccine have been administered in the UK. There's been some very high-level medical research on the side effects, the efficacy, the safety of these vaccines. So as medical professionals, we do recommend that people take the vaccine. And the key word there, sister, is recommend. My duty as a doctor is to make sure my patients and the public have all the correct information when making the decision. And it is a decision when individuals choose to get vaccinated. And as I said earlier, I wanted to reiterate what I said earlier, which was every time I meet an unvaccinated patient who's seriously sick with COVID-19, every single one of them regret not getting vaccinated. I think I've answered the question, Shaf.
Yeah, I'm just going to, let me just elaborate on that. For example, there's compulsory vaccination. You can't enter Pakistan, for example, without being double vaccinated. You can't go to Umrah or Hajj. You can't go to the United Arab Emirates. There's a lot of, everyday life choices that are taken away from people like this sister, many others who just don't feel the science proves that the vaccine is safe.
I can imagine the frustration. Like I said, there is an overwhelming amount of data, information that's circulating. Some of it's true, some of it's not quite true, and some of it is completely wrong. As for foreign policy, I'm an NHS doctor. I can't really comment on foreign policy.
Yeah, I don't necessarily mean foreign policy. I mean decisions being taken by other governments around the world to protect their own population by saying that compulsory vaccination is something that has to happen. Let's just go back to the sister. Are you still there? Let's just get your final comments. What's your reaction? Yes. What's your reaction to what Dr. Jahangir just said?
Thank you very much for answering those questions and doing it calmly and contently. The only thing is, brother, I have heard that so many times before, and I keep hearing the same things all over and over again. For those people who have any sort of knowledge about mRNA and genetics and how much we know about genetics and epidemiology, epigenetics in general, we know very little. That is a fact. So when we're reading up figures from the national statistic, etc., it is just all the same things we're repeating. shouldn't we as Muslims encourage more research? Shouldn't we as Muslims say that if someone has something against it, well, we value your opinion instead of labeling them as anti-vaxxers?
Okay. Thank you so much, sister. Thank you so much for your call. I'm just conscious we've got lots of calls waiting. I want to really go back to you, Dr. Jahangir, as well. Can I just take one more call? Let's take a brother. I think we've got Brother Mohammed there from Leicestershire. Brother Mohammed, are you there?
Assalamu alaikum.
Wa alaikum salam. Apologies keeping you waiting, but yeah, what would you like to say?
My name's Mohammed Amin, and what I would like to say is, firstly, I would to thank Abdul Hamied to come on and explain the equalities, and also Dr. Jahangir Alom. You guys have been doing a fantastic job working in this current epidemic. From my point of view is that there's always these issues with BME communities, and especially the Muslim community. And what I would strongly ask you guys, obviously, you are at the coalface at the moment to try to get us out of this rut. However, you need to feed back into the system to say all these inner city areas, there should be provision for comprehensive NHS services where people are offered screening services. So all the other elements that the Asian BME people have suffered, statistically, they've been at high risk with this COVID-19 because of additional ailments they've got.
Brother Mohammed,
maybe
is that...
if we improve their quality of life, it will get better.
Okay.
What are your thoughts on that?
I'm just going to ask you a question on that. I mean, obviously, it's not something which the NHS doctors individually could respond to. It's maybe a policy discussion for ministers and government and political parties by putting the resources in there to tackle the inequality that exists within the system.
Yes. I've already raised that with my local MP about the inequalities with regards to NHS services in inner city areas. But my only concern is that the rollout of this COVID-19 vaccine, by announcing into mosques, places where mainly the elderly go, the imams have done a fantastic job. But we're still finding that because of social media, so much rubbish is being circulated, and those children go back home and tell their parents, say, no, this vaccine's wrong, this vaccine's wrong. I've been very privileged enough to go to Umrah and Hajj, and yeah, I didn't batter an eyelid whether I had my tetanus, my Hep A and my meningitis vaccines because it was a requirement, and mashallah, nothing happened to me. And this is what people do not understand. This COVID-19 is a nasty type of illness, and that's why these vaccines are there to protect us. No NHS doctor would knowingly vaccinate me for well knowing that it's going to kill me. And this is what these are stupid messages that are going out on social media.
Mohammed, I mean, you very powerfully articulated what many of us are feeling. Thank you so much for joining us. Dr. Jahangir, there are two very distinct, different viewpoints and opinions. Sister very much thinking that we shouldn't be forced to have this vaccine. And Mohammed Amin talking about, I know that political aspirations and conversations around the inequality, but the sense that the NHS has delivered the best rollout of a vaccine, I would argue, in the history of this country and, around the world, shows that we can do it when we put our mind to it. How do we tackle some of those inequalities that some of these deprived communities, like the one you serve in, can be eradicated?
Absolutely. That was a brilliant question and some very kind words from the brother. So thank you very much. As I explained earlier, the inequalities from the pandemic or inequalities in society have been highlighted even more so through the pandemic. And as the brother said, working with faith leaders like imams have done a fantastic job in facilitating trust between underserved communities and communities that have been underserved for decades, to ensure that people were understanding public health messaging, people were getting the right services, and people had access to vaccines. We saw a number of mosques and masjids across the country hosting vaccine centres. The East London Masjid in my community hosts a pop-up clinic every week, and we have several people who would never get vaccinated in a vaccine centre, a GP centre or a hospital, come to their safe space, come to their holy space to get vaccinated, to make sure that they were on top of their health, to make sure they were protected. And we can take a lot of learning from that. And in the future, we can work with communities, we can work with faith leaders to ensure that other programs and other aspects of people's lives are looked after and are addressed. We've taken so much learning from the inequalities in terms of housing, how people's homes are ventilated, the structure of some people's families, so multi-generation homes, and some people who work in the gig economy. So we know that people who come from ethnic minority communities are overrepresented in gig economy, such as Uber drivers and delivery drivers. And so making sure that they have access to sick pay, statutory sick pay, and other provisions to make sure everyone in society has access to good healthcare.
Final question, we've got about 90 seconds left. How do you think this pandemic will end? I mean, Prime Minister talking about that, and the Health Secretary, Sajid Javid, talking today about having to live with this. What do you think? When do we feel as if we can move to some sort of normality?
I think that's quite a complex question. I think slowly and gradually we have to be cautious with the data, with what's going around us, especially in the NHS. Viruses and infectious diseases will always be around. It might be the end of one pandemic and there'll be another one brewing soon. But it's the lessons that we learn from here to ensure that next time something like this happens, that we're well prepared and the lessons are learned and implemented sooner rather than later.
Well, we know one thing, and that is the NHS has been absolutely magnificent. So from all of us here and all the people watching, thank you so much for all that you do, Dr. Jahangir Alom. We wish you well.
So much.
Thank you so much for joining us there, Dr. Jahangir Alom, who is an A&E doctor at Bart's Hospital in East London, joining us live from there now. After the break, we're going to head to Cardiff in Wales to talk to Dr. Bnar Talabani about the vaccine and the science and her story. Join us on the other side of these very important messages. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum, welcome back to Questions with me, Mohammed Shafiq, for the last segment. Wow, where's the night gone? Let's move on to our final guest. Since the vaccine was discovered, tested and approved, almost 9 billion doses have been rolled out. But really, how safe is the science behind the vaccine? And what do we make of the fake news and the so-called experts who say it is not safe? Dr. Bnar Talabani was born in Kurdistan in northern Iraq, and she came to the UK as a refugee. She went to university to study medicine and trained as a doctor in kidney medicine and a scientist in immunology, study of the immune system. She's a founding member of the Muslim Doctors Cymru, which is Muslim Doctors Wales, who've used social media to educate people on the vaccine and coping during this pandemic. I'm pleased to say Dr. Bnar Talabani is joining us live from Cardiff in Wales. Dr. Bnar, assalamu alaikum. Well, a warm welcome to the programme. Great to have this conversation.
Alaikum assalam. Thank you for having me.
First of all, let me say this. I've said this to you a number of times privately, but let me say to you, congratulations on your MBE as part of the New Year's honour. How do you feel to be recognised?
Thank you. I'm still in shock, if I'm entirely honest, but I'm very grateful. And I just want to pay tribute to my colleagues who've also worked tirelessly over the past year to help arm people with accurate information on the COVID vaccines.
So let me ask you the simplest question. How safe is the COVID vaccine?
Very safe. And if it wasn't safe, I wouldn't have had both my doses and my booster by now, as my whole family has. Not only did we have really good clinical trials, robust clinical trials data proving their safety, but we actually have now given over 9 billion doses, just under 9 billion doses globally, with continuous monitoring of things like side effects, efficacy, and all sorts of other things that we always monitor for new treatments and new vaccines. And so from all that data, we know that they're very safe and that they work. Yeah, so
you've agreed to take questions as Dr. Jahangir did. So number you can call us live. I need to put my teeth back in. 01924 231 083. Call us now, and if you've got a question. But we've got quite a few questions to come through, but I just wanted to, let's just set the scene. What does the science say behind the vaccine?
So I'll talk about the mRNA vaccine.
Please.
Because the AstraZeneca vaccine is a long-standing platform. So one of your callers said that mRNA is new. Actually, there's 50 years worth of research on mRNA.
Did you say 50?
50 years worth of
wow.
research, on mRNA and mRNA technologies. And these are actually not the first vaccines to be given to humans, because years and years ago, we used them in clinical trials in humans for different vaccines. They weren't approved because they were safe, but they didn't work as well. These ones work really well. So actually, we've got years of data telling us that this technology is safe and that it works. The way that it works is if you imagine that my hand is the virus, the palm of my hand is the actual virus, and on top of the virus sits lots of different types of proteins. One of those proteins is a spike protein, and the spike protein is the bit that helps the virus to enter our cells and causes damage. So the vaccine takes just the spike protein here and converts that into a blueprint of information, so that when we give the vaccine into our arm, the cells in our arm learns how to make that spike protein. Our immune system goes along, reads the information. The vaccine contents are gone within a few days of having the vaccine, doesn't stick around the body. The spike protein's gone within a couple of weeks of having the vaccine, doesn't travel around the body or anything. The only thing that's left is our immune response, which is the bit that protects us from COVID. So this is why vaccines can't cause long-term side effects like we're hearing on social media, because it doesn't stick around. The contents are gone within a couple of weeks of actually having the vaccine. And then that immune response is what keeps us protected, so that if we come into contact with COVID later, we can neutralize it and prevent infection in the majority who have the vaccines. The few who can still catch the infection after having the vaccines still have our second line of defense that actually helps to prevent severe disease. And that's why vaccines reduce our risk of catching COVID in the first place. But even for the few who catch it, their risk of ending up in hospital is significantly lower because they're vaccinated.
So there's no 5G chip that's left behind in the body?
Sorry, you're going to have rubbish signal after your vaccination.
Sorry, I just wanted to put that out there because I remember that was one of the first questions, one of the fake news that was going out there. Now, surely, picking up what the caller said as well, shouldn't vaccines take years of research, testing before they're rolled out and not rushed? People are not anti-vaxxers. They just feel as if the fast pace of rolling this out is causing them concern. Do you understand that?
I do, and it's actually a common misconception that they were rushed, because they actually weren't rushed. If you imagine that we conduct hundreds of clinical trials a year and all other research was stopped and only these clinical trials and COVID research was prioritized, and that we have technology now that we didn't have 10, 20 years ago. So my PhD that I'm doing at the moment is actually using genetic sequencing in the field of immunology. And genetic sequencing is something we didn't have 10 years ago. And through genetic sequencing, we can identify viruses, we can study them very, very quickly. We also have other technologies that has meant that we can actually create the vaccine itself very, very quickly. And then in terms of testing it, all the normal tests that we do on every other medication, vaccine that other treatments have gone through, these have also gone through. They've been tested on animals, shown to be safe. They've been tested in human clinical trials in very, very large numbers. And so all of the testing that would have normally been done has been done on these ones. The reason it was done so efficiently is because of good funding, technology, because it was prioritized and everything else was stopped, because we cut out a lot of the red tape that we normally have to face as scientists when doing research. And it was just get the research done and get the information to make sure it's safe and effective before we roll it out. And the other big difference is normally we do one bit and then we pause, and we do another bit and then we pause. All of the different stages happened in parallel. And as information was coming out, rather than waiting months for independent scientists to sit down and look at the studies, it was being looked at immediately as it was coming out. The whole process was so much more efficient. And it's actually going to change how we do clinical trials and how we do research in the future to try and be more efficient.
And, the other thing I was talking to Dr. Jahangir about is you go to your GP, you tell them your symptom, they give you a prescription, they give you a medication. You don't question that prescription. You don't question what's in the medication. You just take it because you trust your GP. Yet now people are going to the GP and saying, "Oh no, I'm not having the COVID because I seem to know better." How do you counter that?
It's very difficult because, and I feel for people who have been exposed to so much misinformation. If you go on social media, 90% of what you'll be exposed to about these vaccines is absolute nonsense. And as a scientist and doctor, I can see that. I can tell the difference between what's accurate and what's not. But if you're not trained in those fields, it's very difficult to do that. And actually, it's very easy to get very worried by the stuff that you're seeing. The only thing that people need to understand is that if these vaccines weren't safe and weren't effective, they would not have been approved. And if they don't work and, again, are not safe, people like myself, doctors and scientists, the vast majority of us are all vaccinated. And that tells you everything that you need to know, because not only am I vaccinated, my family are all vaccinated on my advice. And if it wasn't safe, would I really be doing that?
Okay, yeah, exactly. Well, and I kind of feel the same way. I look at my GP and look at my NHS colleagues, my friends, family members who work in the NHS, and pretty much all of them have taken it. And certainly, what's the situation like in the NHS around taking the vaccine as well? Because that, again, is a vote of confidence in it.
Yeah, so I think that, we've recently heard on the news and on some social media outlets about some doctors who are hesitant and who've come out. And one particular doctor, I made a video to debunk the claims that he made when he met Sajid Javid recently, the health minister. And actually everything he said to back up his view to not have the vaccine was actually incorrect. It was inaccurate. And I think it's a really good example of recognizing that as doctors and as healthcare professionals, we don't have much training in immunology, in basic science. And so actually, we will have some people who are victims of misinformation, even if they're healthcare professionals themselves. But my advice to anyone listening here today is don't base your decision on anyone's opinion, including mine. My opinion is irrelevant. Everyone's opinion is irrelevant. It's the science. The science is lacking, the science is void of bias. It gives a balanced overview with lots and lots and lots of data from different perspectives and different groups of people. And that science has proven the vaccines to be safe and effective. And that's why the overwhelming majority of healthcare workers, doctors, and scientists have had their vaccines.
And how do you counter some of that fake news? I mean, you mentioned that the doctor you're talking who met the health secretary in that hospital, but we do know that the compulsory vaccination is going to come by April. How much damage do you think that's going to have if people don't take it?
I would be very surprised if it came down to it that a large proportion of those who are not yet vaccinated don't go on to have their vaccine, actually, because I think if you actually, a lot of people in the NHS, the vast majority are vaccinated. The few who have remained unvaccinated have either become victims of misinformation or have kind of just kept putting it off because they don't think they're at risk of COVID or whatever other reason. Actually, when you put that mandate in place, the vast majority of them will be forced to actually look at the evidence and make a decision. And the science really speaks for itself. I keep saying the science has proven them to be safe and effective. It really has. And we do have robust data on these vaccines. One of your callers said that we need more research. We've given more than just under 9 billion doses. And we gave them we started giving them about 2 years ago now. And because of what we know about vaccines and how they work, we know that vaccine side effects present within a few weeks of having it. So you can't have a vaccine, then develop issues with it years. It doesn't work like that. So actually, when you take a step back and look at the science, it's actually all very reassuring. So I do believe that the vast majority of healthcare workers who are not yet vaccinated will go on to have their vaccines.
Do you think that's a real failure on the part of those NHS staff to know how dangerous it is for them and their loved ones if they remain unvaccinated? Because they could capture it, they could get something and then pass it on to their loved ones, but also pass it on to vulnerable patients that they're treating.
Yeah. So this is exactly why I support.
Quite selfish, isn't it?
Well, this is why I support the mandates in the NHS, because as healthcare workers, our priority has to be the health of our patients. And we have a right to refuse treatment for ourselves, but we don't have a right to have those choices impact other people, particularly our patients, who on the whole are quite vulnerable. And vulnerable people, even when they have their vaccines, are not going to derive the same protection from it like you and I would, because they have weaker immune systems. So actually, it's our duty to do our bit to protect them. I think a lot of those people are misled, but my issue is when healthcare workers use their name and voice as healthcare workers to then mislead others. I don't think that's acceptable. If you don't understand the science, that's fine, but do not spread misinformation and put other people off, because someone else will watch that and say, oh, well, he's a doctor or she's a doctor. I'm going to do what they say. They've said it's not safe. And that's completely wrong.
Okay, thank you so much. I know you're going to stay with us. We're going to take some time now for our final break. And when we come back, we'll continue the conversation with Dr. Talabani. We'll open the lines as well to take some of your calls, 01924 231 083. This is our special on COVID-19. And it's the final break. And when we come back, we'll hopefully take some calls. And there's some questions that have come through as well. So if you want to send us a question, you can do that on WhatsApp. Assalamu alaikum. Assalamu alaikum. Welcome back to Questions with me, Mohammed Shafiq, for this final segment. Wow, final part of the program. Where has the time gone? I've really been educated tonight on this important topic of COVID, the vaccine. My special guest is Dr. Bnar Talabani, who's MBE, who's joining us live from Cardiff in Wales. We agreed to open the line, 01924 231 083. And I just wanted to ask you, what impact, we had this with Dr. Jahangir and also Abdul Hamied, what impact do you think not having the vaccine, because the figures, I don't know if you know this, but Indian take-up of the booster is 70%, Bangladeshis it's on 56%, and Pakistanis just 50%. So lots of people who are adversely impacted by COVID are less likely to take a booster. How do you deal with that?
It's really difficult, and there's a lot of misinformation in our communities, but also there's a lot of mistrust, and that mistrust is based on historical issues with healthcare inequality. So actually, it's not going to be easy to undo that. The only thing I would say is the evidence is very clear that if you are, like myself and like these communities, from a BAME background, so ethnic minority background, our risk of COVID, with severe COVID, our risk if we catch COVID is higher, significantly higher than someone who's from a Caucasian population. And we also know that the vaccines are safe in our communities because we've given them not only in clinical trials to people from our communities, but also of the 9 billion doses that have been given so far, significant numbers have been given to people from BAME communities. So we know they're safe and we know they work. So if you are from that community and you're yet to be vaccinated, please consider it. Do not listen to the nonsense that you are being sent on social media. It's safe. If it wasn't, I wouldn't be vaccinated fully and then boosted.
There is a question coming through on WhatsApp. It says, Salam, I wanted to ask, my wife is due a second jab, but she is 21 weeks pregnant. She's a bit scared about after the first jab, but she had the first jab about 8 months ago. Can you give us some advice and reassurance?
Assalamu alaikum, brother, and congratulations. So COVID in pregnancy is very, very dangerous. It increases the risk of, I'm going to just give it to you straight because I think you need to have all the information, and the information is actually very scary. COVID infection in pregnancy is dangerous. It increases the risk of death for mum by 70%. It doubles to triples the risk of complications like stillbirth and baby being born small for weight, baby being born early and needing intensive care, and all sorts of other pregnancy complications. The good news is that we've got lots of research and lots of data on over just under 200,000 women now who've received the COVID vaccines in pregnancy. And we know it's safe in pregnancy. We know it doesn't increase any of the pregnancy complications. It's safe for mum and it's safe for baby. The actual contents of the vaccine don't cross the placenta into the baby. That stays in mum's arm. The only thing that crosses the placenta is mum's immune cells that she produces to protect herself and her baby. So, subhanAllah, the wonderful thing is that if your wife was to go and have the vaccine tomorrow, her second dose, and then her booster dose when she's due it 3 months later, she would be passing on that protection to her baby without her baby having even come into contact with the COVID vaccines. So the data on COVID vaccines in pregnancy is very, very good. It's very, very safe, but COVID infection is not. So I would implore you to have the vaccine, or rather ask your wife to have the vaccine. And if she's worried and she has more questions, I'm happy to be contacted on social media, or please go and speak to her GP.
Yeah, that's really important. Now, do you think the vaccine, well, the question which is also being asked on social media is, do vaccines affect fertility, as some claim that they do, and lots of young women who are getting married are a bit worried about this. What's your response to that?
Yeah, really good question. So the ex-scientist who made that claim had absolutely no evidence to be going around saying making claims like that. And actually, since the vaccine rollout, we've had 15 studies with really large sample sizes of patients who've been monitored for fertility. And actually, we have no evidence that the vaccines impact fertility at all. In fact, all the studies that have looked at this have shown the vaccines have no impact on fertility. And there is no plausible or biological way in which vaccines could impact fertility at all. Let's talk about male fertility for a moment, because this is really important. We almost always forget this when we talk about fertility. The vaccines have also looked at men's health, so things like their ability, things like sperm count, sperm quantity, sperm quality. And again, that research has shown there's absolutely no impact on any of that if a man has their vaccine. COVID infection can cause male infertility. So COVID infection can increase the risk of things like erectile dysfunction by a factor of 6 to 8. And we've got more and more studies, and we're talking about young men who had mild COVID to begin with, who are struggling with fertility now because they caught COVID. So again, on balance, the vaccines are safe for men and women where fertility is concerned, but COVID potentially is not in men. And we don't really have it. We don't think that COVID infection impacts fertility in women, but there are some case reports suggesting that it might.
And when will we know more data around the impact it has on fertility, if it has that adverse impact that you've set out?
So the vaccines don't impact fertility. We have lots and lots of data confirming that. So there isn't really a question.
Oh, so we know that already now.
We know that already. What we don't have, what we have evidence, early evidence, is that COVID infection can cause premature ovarian failure in women, but we need more data on that. But we know the vaccines are safe for women's fertility. We know the vaccines are safe for men's fertility. But we have good data that COVID infection is not good for men's fertility and may not be good for women's fertility. Now, that's the infection.
Yeah, thank you for that. And as I said, potentially we might take a few calls, but 01924231083. I've got quite a few questions left, and we've probably got about 6 minutes left, so I wanted to get through some of them if I could. There is one claim that the reason doctors and NHS are so keen on the vaccine is because they're being paid per dose. And that's why they're so keen on it. What would you respond to that?
So people like myself who are doing this, on social media, I'm not being paid any money for it. Neither are my colleagues on Team Halo Muslim Doctors Company. We're doing it. We're doing it because it's the right thing to do, because there's so much misinformation flying around. We want to make sure people have access to accurate information. In our faith, in our religion, in Islam, it's important to share knowledge if you have it and to educate if you have it. And I have a duty as a Muslim to make sure that I share my knowledge with people, because ultimately, even if this past year, all the work that I've done in my spare time to try and share accurate information on the COVID vaccine, even if that helps to save just one life, for me, that's worth it in the eyes of Allah. So that's why I'm doing it. I think the question might be from why are GPs being paid to give the vaccine? And actually, I think we need to just break it down a bit, because if you imagine that GP practices are giving the vaccination, that means they either have to hire staff to give the vaccine, or they have to get their own staff to give the vaccine and hire staff to cover the job of that person. We know that GP practices are overrun. They were already overrun before the pandemic, but the pandemic has really stretched them beyond limits. They sometimes have to hire different places to be able to vaccinate, because if their own surgery doesn't allow social distancing to keep vulnerable patients safe, with the wait that we have to do after the vaccine, they have to pay for that. And they have to pay for extra PPE to be able to vaccinate. So actually, the data that's looked at this has shown that on the whole, GP practices are actually losing money by giving vaccination, but because it's the right thing to do, they're doing it anyway. So I think, we just need to kind of put that to bed, that nobody benefits from the vaccination except for everybody, because we want to get out of this pandemic, and that's it.
So we know that today Boris Johnson and Sajid Javid announced the scrapping of Plan B restrictions here in England. In Wales, it's devolved. Mark Dreyford, the First Minister, has a slower, pace, if you like, in terms of getting the restrictions. What impact do you think, with cases being so high, will this have on our ability to deal with the pandemic?
I have to say that as a doctor and scientist, I share the view of my colleagues who are concerned about the scrapping of all of the restrictions. I think simple measures like wearing masks and implementing good ventilation indoors, we know reduces transmission significantly. And it's a very simple, small inconvenience to implement, but something that gives us a lot of protection in slowing down numbers. And I think the kind of the end goal to this is to vaccinate enough people in the population that we're not just protected as individuals and those around us, but actually as a population, we reach what's called herd immunity, so we can suppress the spread of the virus. This virus is not going to go away. Maybe the first couple of strains, the first couple of variants, we could have eradicated, but the Omicron variant, because it's just so easy to spread, it's not going to go away. So now that restrictions are lifted in England, if you live in England, now is the time to get vaccinated, because your risk of being exposed to COVID is now going to suddenly get much higher than it was before. So if you're not vaccinated, your protection is suddenly non-existent. And I have family in England who are going to continue to wear masks and continue to implement good ventilation indoors on my advice, because that's the right thing to do. And they're all thankfully vaccinated as well. So that's another layer of protection that they've provided for themselves.
And based on your scientific experience and experience in the medical field as an NHS doctor, how do you think we'll come out of this pandemic?
Yeah, so I think that's the end goal. So, I think the decision that's been made to remove all measures has been based on hospitalization numbers. And actually the hospitals, although the case rates are starting to fall in hospitals, are struggling. We're hoping that this is now the peak of it and it'll start to go down. Nobody has talked about long COVID and Omicron. Long COVID is debilitating. It's causing disability in otherwise young, fit and healthy people who were completely well before they had COVID. Long COVID is just as common in young people as people who are older. And we're talking about chronic organ damage. We're talking about disability, strokes, amputations, because COVID causes all these complications that we don't really often talk about. And so we know that vaccines reduce our risk of long COVID and catching COVID and ending up in hospital and passing it on. So the way to really come out of this, the end point here is going to be vaccinating enough people in the population so that if a new variant comes along, and it's likely because we haven't vaccinated enough people globally, and we know that new variants come about in areas with low vaccination and high disease spread. So if a new variant comes along, if you have a population that's majority vaccinated, that is going to protect not just the individual, but also the overall population as a whole. And so we're not going to see huge surges of cases and hospitalizations. What we're going to just see is a bit of a plateau because we've vaccinated enough people. And this is true for all other viruses we've vaccinated against as well.
Well, thank you so much for joining us, Dr. Bnar Talabani, MBE. Thank you so much for all that you do and your colleagues do in Wales. And we wish you well. Thank you so much. That was Dr. Bnar Talabani, the NHS doctor and founder of the Muslims Doctors Cymru, joining us live from British Muslim TV live on British Muslim TV from Cardiff in Wales. Wow, what a fascinating and educational show we've had tonight. Thank you so much. We've reached the end of our program. Firstly, I want to thank my special guests tonight, Abdul Hamied, Dr. Jahangir Alom and Dr. Bnar Talabani. We're back on the screen next Wednesday at the same time of 8:30. From me and the whole team behind the scenes, thank you so much for joining us. And I'll see you next week. Take care of yourself and each other. Assalamu alaikum wa rahmatullahi wa barakatuh.